Hello! With Father's Day just around the corner, I want you to forget about the fishing poles and the beer mugs and the number one dad shirts and instead give the dads in your life some super useful knowledge instead. Whether that's your 34-year-old husband who's celebrating his very first Father's Day or your 87-year-old dad who absolutely hates getting cheerful Hallmark cards. We are going to talk about male Kegels. So, Kegels are exercises for both men and women that focus on the bowl of muscle that sits between our hips. Those muscles hold up our bladder and our bowels. In women, they also hold up the uterus, and in men, they hold up the prostate. Those muscles are very important. If they are not functioning well, meaning they're too tight or too weak, too uncoordinated, too scarred or in spasm, or a whole host of other things that can happen, you may experience urinary or fecal incontinence, pelvic pain, constipation, chronic back or hip pain, urgency or frequency, erectile dysfunction, or a number of other symptoms. So I'm going to give you a quick primer on how men should specifically do their Kegels. The cues are a little different than what we say for women. And I'll follow up with some tips and tricks as well. Ready? Okay, you're going to sit up straight with your feet flat on the ground. Keep your shoulders, your belly, your legs, and your jaw relaxed. You're going to breathe in, and on your exhale, I want you to do 3 things. 1, shorten the penis. 2, bring your nuts to your guts. And 3, squeeze around the anal sphincter like you don't want to pass gas. Hold it, and now exhale, letting everything go. We're going to do that again. You're going to breathe into the belly, filling up, and you're going to 1, shorten the penis. 2, bring your nuts to your guts, meaning lift your testicles. And 3, squeeze around the anal sphincter like you don't want to pass gas. Hold it. And exhale, letting everything go. Strengthening the pelvic muscles can help with erectile function, that little bit of dribble after you pee, leakage when you're lifting heavy, or just in general. These are muscles like anywhere else in the body, but because we don't see them, we think about them differently than our biceps or our upper traps. They often need strengthening just as much as other parts of the body. No one I've ever met is looking forward to being incontinent and in diapers in their later years. Now here's 3 tips for when you're doing your Kegels. 1, don't squeeze your whole butt, right? If you're going up, that means that you're squeezing your glutes, you're squeezing your bottom. Don't tighten your legs and don't tighten your abs. Just focus on the muscles between your legs. 2, don't practice this while you're peeing. I can't emphasize this enough. When we urinate, we want those muscles to relax. We don't want them to tighten up. We kind of confuse our bladder and our brain about what we're asking the muscles to do if we get on the toilet or we're standing and we're tightening these muscles. So don't practice them while you're peeing. And finally, don't forget to breathe, especially if you're working on holding these Kegels for longer. We call those endurance holds. If you are leaking on your way to the bathroom, let's say you are struggling to unbutton your pants, and you need to work on being able to hold on for a little bit longer, 10 seconds, 30 seconds, maybe even longer, those endurance holds are really helpful, but we also want to make sure you're breathing. So make sure you're breathing if you're doing longer endurance Kegel holds. Try to incorporate this into your daily routine. So while you're brushing your teeth, after you're done urinating, while you're washing the dishes, or telling your partner how wonderful and amazing they are, make it part of your regular routine. That way you will incorporate it into your daily life just like you might a walk around the neighborhood or going to the gym and working out. Side note, there are many types of Kegels. We just talked about those endurance holds, which is a different type of strengthening Kegel. And most of them do focus on strengthening, but not everyone needs to be working on tightening these muscles. Sometimes the muscles are too tight, and that's what's causing the problem. If you're not sure what's going on with the plumbing down below, don't wait. Don't search Dr. Google and hope that there's going to be an answer that's going to appear. Find a pelvic physical therapist near you and get some solid guidance on what's going on and what's the right course of action specifically for your body. Many of us treat men as well as women, and we are happy to do so. There's a lot of really wonderful pelvic physical therapists out there who will be more than happy to help with whatever you're dealing with. So In the meantime, happy Father's Day, happy Kegeling, and please pass this along so that you can brighten the day of the men that you love in your life. Thank you.